Welcome to Thursday. It is Meet the Press Daily. Good evening. I'm Chuck Todd here in Washington as this nation braces for a public health storm of unknown strength, size, and duration. There is a once-in-a-lifetime disaster preparedness effort being undertaken across the country right now. We have never before in modern life experienced the kind of social and economic disruption that is about to happen or is already happening in and around our communities from coast to coast. We got a lot of developments to get to, a lot of questions that we want more answers for. Over the next hour, we're going to be talking to experts in medicine, infectious diseases, testing and mitigation, reporters who are covering beats in health, politics, and international hotspots, a governor who's on the front lines dealing with a state of emergency. All of these folks are going to try to help all of us wrap our arms around the extent of this approaching storm. I'm from Florida, where we know a thing or two about preparing for some pretty scary storms. You either hunker down or you get out of Dodge. But we generally have a sense of how prepared we need to be and how much to disrupt our daily lives, because we usually have a sense of how big and intense the approaching storm will be and when it's going to hit, and perhaps even how long it'll take us to recover. But in the case of the coronavirus, there's a sense of confusion, and that's leading to a bit of panic. Are we preparing enough? Is it too much? Is it just right? Well, frankly, that all depends on the size and scope and lethality of the virus itself. But that's the problem. What we're learning today from public health officials is that we don't know about the actual or predicted scope of the approaching storm. And there are questions about whether we should at this point in time. There's a large argument that says, under certain circumstances, we would know more. One of the most trusted public health officials on the White House's coronavirus task force, Dr. Anthony Fauci, testified today. In countries, testing regimen is failing.
Quickly, the system is not really geared to what we need right now. It is a failing. I mean, let's admit it. The fact is, the way the system was set up is that the public health component that Dr. Redfield was talking about was a system where you put it out there in the public and a physician asks for it and you get it. The idea of anybody getting it easily, the way people in other countries are doing it, we're not set up for that. Do I think we should be? Yes, but we're not.
So there's Fauci basically saying it's systemic. Right now, the number of cases in the United States has risen to about 1,300. 38 deaths with the social gatherings that drive life in America are shuttering, it seems like, by the second. I think as we went to air, we learned of Disneyland. All major sports leagues have virtually shut down. Major conferences have too. The NCAA tournament is off. Large gatherings are being banned in some states. Travel, both for business and pleasure, canceled. Broadway officially goes dark tonight. As I mentioned, Disneyland is shut down. One would assume that if you've made the Disneyland decision, the Disney World decision is likely to come. Workplaces increasingly want you to stay home. Financial markets are still reeling. Single worst day, by the way, of decline since the 1987 market crash. And the disconcerting thing is that we don't know if this means the approaching storm is going to be a Category 1 or a 5. Perhaps even more disconcerting is that Dr. Anthony Fauci made comments today suggesting that no amount of testing is going to give us that answer either.
Testing now is not going to tell you how many cases you're going to have. Mm-hmm. What will tell you what you're going to have will be how you respond to it with containment and mitigation. Right now, all of us, regardless of what testing is going on, need to be doing the kind of distancing, avoiding crowds, teleworking where possible. I said it many times and I'll say it again. This is not business as usual. If you live in a state or a region where there are just a few or no cases, it doesn't matter.
Hello, YouTubers. If you're watching this, it means you've checked out our channel, so thank you. Now do me a favor, subscribe by clicking on that button down there. Click on any of the videos to watch the latest interviews and highlights from MTP Daily and MSNBC. You can get more Meet the Press content every morning in the First Read newsletter. If you're tired of content that you don't know anything about where it came from, you don't have to have that problem with us. NBC News, MSNBC, MTP, and the Meet the Press mindset right here for you on YouTube. Subscribe now.